Hi, everyone. Good to see y'all. I think we'll start in a couple of minutes. We're still waiting for attendees, but you're most welcome. Thanks for joining. Hi, everyone. I see more people are joining. It's great. Um, I see we have almost 20 people. Maybe we can wait for like 30 seconds, a minute, and then we can start. And I think just to let everyone know, it's being recorded. So okay, perhaps I'll start just so that we don't lose out on time. So good afternoon, good morning, good evening. I'm assuming people are joining from all over the world. Very pleased to have you all with us today. My name is Anjana Verma. I'm currently the acting head for the Nature for Health Secretariat, which is based in the UN Environment Program, based out of Nairobi. So welcome. This is the first inaugural sort of webinar that we're doing, focusing on upstream prevention and really trying to have a dialogue on upstream prevention. We would like to do more of these this year, and happy to have suggestions. If you work in this space, if you know of speakers or areas of expertise that we should highlight, please feel free to reach out to us. For those of you who don't know or who might be new to this, Nature for Health is a global initiative, um, uh, and it has 7 partners working across different mandates in environment and health, and really trying to reduce the risk of health crises by addressing sort of the environmental drivers, or what we call upstream prevention. So really, upstream prevention talks to this idea of, shifting the narrative, shifting the lens, whether it's going from being reactive to proactive, or from looking at how we can create enabling conditions for people to thrive rather than just sort of addressing diseases as as they're emerging or as they're being transmitted. So you can find out, of course, more about Nature for Health through our website, natureforhealth.org. Perhaps one of my colleagues can put the link in the chat if they don't mind. Yeah, we talk a lot about One Health. This is an approach that we, of course, advocate for. It's something that we see as important when we talk about the linkages between humans, animals, and the environment. And I think this is especially relevant in today's world, given the health landscape, given the geopolitical landscape. And I think there's this recognition, and I'm sure those who are joining us today are very much advocates as well, because you have an interest in joining this webinar. But really, this recognition that we cannot look at these massive, protracted challenges, whether it's biodiversity loss or water insecurity, food insecurity, climate issues, health issues in isolation. It's just simply not enough. And so this is why we're really delighted to be talking about the IPBES Nexus Assessment. IPBES is the intergovernmental platform on science policy panel. Please correct me if I got it right. On biodiversity and ecosystem services. Yes, it's a very long title, IPBES. So we have Paula here with us today. Dr. Paula Priest, who is a biologist by training, and she has a background, of course, in landscape ecology with a focus on conservation efforts, restoration, land use, planning, and human health. She's also the senior program coordinator for forest and grasslands work in IUCN, and she's leading the IUCN thematic group on human health. So it's a pleasure to have you with us. You will, of course, run us through a presentation on the IPBES Nexus Assessment, which came out, I believe, in December 2024. But it is as relevant as ever, especially because I think it's perhaps the first time that such a study has been done at such a scale, looking at these nexus interlinkages. You will tell us more about it. So I think just to kind of run you through quickly, we will have the presentation for about 25 minutes or so, and then we'll open it up for a Q&A, a dialogue, an interactive session. So feel free to, if you want to already put in comments and questions, you can use the Q&A tab. If you'd like to introduce yourself, please use the chat function. Happy to also get to know where you all are joining us from today. So with that, I'll just hand over to you, Paula, if that's okay. And yeah, over to you. Thanks so much.
Thank you so much for the invitation. Let me just share my screen. I hope you're all seeing my slides. Let me just put on presentation mode, and then you see that I will be looking to the other screen just because I want to see some faces. And when I am on presentation mode on my screen, I just see the slides, which is odd because I don't want to be presenting to myself. But as Angela mentioned, I am Paula Priest. I was one of the coordinating lead authors of the IPBES Nexus Assessment. And today I'm just going to give a brief overview because this is a huge assessment about the health findings of this IPBES Nexus report. And before I start, I just want to give a small overview about, let me just change the slides here, about what was the Nexus. So the Nexus was the most complex and the largest assessment ever made by the IPBES. It was produced over a period of 3 years. And during this time, we had 3 in-person outdoor meetings plus 4 in-person meetings just to work on the summer for policymakers. We had 2 external reviews, so a lot of people contributed a lot to this assessment by putting their comments, and we review all of them and we integrated as much as we could. And we also had 1 additional government review just for the summer for policymakers. It used more than 6,000 sources of knowledge. That includes scientific articles, great literature, reports, and also indigenous and local knowledge. So the IPBES set an indigenous knowledge system where we had also 3 in-person meetings with indigenous people to also incorporate their knowledge into their assessment. And all those knowledge citations, they are coming from all the IPBES regions, so it is global. And it was produced with more than 160 experts and had more than 70 contributing authors. So it was a huge assessment. I tried to explain, if you want to read, which chapters to read, because it has more than 1,000 pages, so it is really dense. And we can say that the Nexus is like a follow-up of the IBIS Global Assessment that was published in 2019 and was the first assessment to evaluate the state of biodiversity and ecosystem services worldwide. But different from the global assessment, the Nexus understands that the biodiversity loss is not a sole crisis, like it's not a unique crisis that the world is facing, but that is part of an interconnected crisis. So the crisis of climate change, biodiversity loss, water and food insecurity, and human health, they are interconnected, they interact, and they exacerbate each other's in ways that, if we look at them separately, all of our efforts are going to be ineffective because we're not really understanding what is happening. However, despite those very strong interconnections that we all know, the policies, they are still being made in a single sector way. So they're still just looking at one sector at each time and not acknowledging those interconnections. And this can lead to unintended consequences and trade-offs and can exacerbate some of those global crises, even if unintended. I'm going to talk a little bit about that, but the Nexus came to really acknowledge that those crises, they interact, and trying to understand how those 5 elements, biodiversity, water, food, health, and climate change, interact, exacerbate each other, and then try to provide some response options or some pathways to sustainable futures, as we say, to help policymakers and decision makers to start looking at those crises in this integrated way. So just for you to understand how the assessment is organized, we have 7 chapters. The chapters 1 to 3 is about the framing of the Nexus. So we have one that is introducing the Nexus, what is Nexus, and etc., why it is important. The chapter 2 gives an overview of the past, current, and current trends on the Nexus elements and the drivers that are leading to those trends. The chapter 3 is about future trends, the scenarios. And then we have the chapters 5 to 7 that really state the pathways to sustainable future. For the Nature for Health audience, I would say that the most important chapters to read, it would be the chapter 2 that really gives an idea about what is happening, but also the chapter 5, the response options. And I wouldn't say that only the health part is important, because we're going to see that those response options, they are also interconnected. So you can use some of the biodiversity, water, or food response options. They are going to have a positive health benefit. I'm going to talk briefly about that, but it's impossible to cover all of those response options in here. So I will suggest for you to read the response option chapter, because I think that could be really useful to really integrate those different sectors and see how they're going to be effective for human health. And I'll talking more specifically about the health part. I think it's not new to anyone that we are living longer. Our life expectancy is increasing as never before. And when we see those human health indicators that we used in chapter 2 here, we can see that the child mortality rate is decreasing for the past 50 years. Child malnutrition is also decreasing. Can you see my mouse? No, right? Okay. And then life expectancy is increasing. It's very interesting to see the effect of COVID, the COVID-19 pandemic in those curves, because we had a huge drop in life expectancy, but it is back to normal now. So if we look at those curves, we are already recovering, we are already growing again. However, at the same time that we're living longer, we are not living a healthier life. We are living more years, but the prevalence of no infections chronic disease has increased, and they account currently for 16% of all deaths globally and 44% of deaths in low resource countries. Diabetes and obesity have also escalated, and mental health conditions have significantly increased. So we have this idea that our health is improving because we have so much advancements in the medicine and vaccines, and we're living longer, but at the same time, we're not living a healthier life. And what we saw during the assessment is that the drivers of biodiversity loss that was appointed by the IBIS Global Assessment, that are 5, the most important ones: land and use change, unsustainable exploitation, climate change, pollution, and invasive alien species. They are also the drivers that are leading to our human health loss. And as we can see in those graphs in the right, and I'm sorry that you cannot see my mouse, I'm trying to point to some of those graphs, they are mostly increasing over the past 50 years. So here we show some indicators of those direct drivers of biodiversity loss, and we can see that number of alien species breachings is increasing, the water use for human use, the water withdrawal for human use is also increasing. Air pollution in some regions is increasing. Here we can see that we have a global curve that is the all black, and then we have the curve for income levels. And this can vary depending on the income level. So what we can see here is that at the same time that biodiversity is decreasing, as we can see by this forest coverage indicator, all the other direct drivers, they are increasing, and they are putting pressure on biodiversity, on human health. And I'll just give a few examples of how those direct drivers are affecting human health. But in here, it's important to say that we're talking about human health in general, as this is a global assessment that talks about 5 elements. We're not really splitting and taking a look at how each element or each driver is affecting, for example, just zoonotic diseases. We are always trying to capture the effect on human health in a more holistic way, considering all health aspects. So land and use change and unsustainable exploitation, which it is appointed as the most important driver of biodiversity loss, is also one of the most important drivers of infectious disease emergency. It is linked to more than 30% of the new diseases that emerged since 1960. Pollution has several effects on human health. I'll just bring a few numbers here. Linked to our pollution that is estimated to lead to 9 million premature deaths in 2019, just 1 year, which represents 16% of all deaths worldwide that year. And this is only about air pollution and only about the direct loss. Then we have climate change. I think I don't need to frame how climate change can impact human health directly and indirectly. We have several mechanisms by which climate change can be very detrimental to our health. I think the first one and more easy to think is the direct impacts when we have heat events and those extreme events as floods and wildfires. We have direct loss. People, they just lose their lives because of those variabilities. But we also have the more direct but not so extreme impacts, such as, for example, on mental health impacts with stress and anxiety. We're seeing a lot of anxiety now, especially with teenagers and kids because of climate change. And we also have the indirect impacts through the increases of infectious disease. Climate change is not only changing the range, the home range of vectors and hosts, but is also increasing their abundance and also making them more virulent. And so they have a higher capacity to infect people. So we have lots of mechanisms that are shaping how climate change can affect human health. And at the same time, our body is also affected by those heat stress. So it's also making us more vulnerable to those infections. So it's I normally say there is a catastrophic effect on human health. And then we have invasive alien species, that just to bring a number, is also very negative to human health. 85% of those invasive alien species negatively affect human well-being. And just one example, in South America, I'm from Brazil, the dengue vector, Aedes aegypti, is an invasive alien species. So this shows a very strong example of how this species can really be detrimental to our health. But those direct drivers, they intensify over time, but they are also affected by what we call the indirect drivers, that are those economic, demographic, institutional, cultural, and technological drivers that can intensify or decrease those direct drivers. So in here, for example, in this table, we can see that GDP, trade, population, urbanization, and per capita consumption, they are all presenting intense or slightly intense growth over the past 50 years. So they intensify over the past 50 years, and they all led to a strong intensification of the direct drivers. And then those direct drivers, they directly impact all the 5 nexus elements, including health. But those 5 elements, because those interconnections are complex, they are also directly affected by the indirect drivers. So what we can see here is that every time we increase GDP, trades, population, urbanization, or per capita consumption, we are leading directly to a high negative impact, that are those 2 arrows, or a moderate negative impact on most of the 5 elements of the nexus, including, if you look at the human health and we split by physical and mental, is a completely negative effect. So what happens is that those, if we look with more attention to what is happening, and I know that a lot of people, they don't like this graph, but I think it's very useful to see the general trend. If we just look to the first side, the indirect drivers to the direct drivers, and I'm so sorry that you cannot see my mouse, we can see that all those indirect drivers, they are directly affecting or intensify the direct drivers. If you look at the color pattern, we can see that the purple and the yellow, they are intensification patterns. So we can see clearly that the indirect drivers are intensifying the direct drivers. And because of that, the intensification of the direct drivers are affecting the nexus elements in a negative way. So what we can also see here through this graph is that all the yellow and purple that goes to the second part of the graph means negative. So this shows that what we're seeing here is all bad, is all negative. And we also have the direct impacts between the indirect drivers and the nexus elements. So you see some curves that can cross the direct drivers. So it means that those nexus elements, as we say, they are being affected by all those indirect and direct drivers, and mostly in a negative way. But when we look at this graph, we're not even considering how the change in one nexus element can also cascade and feed back into the other nexus elements. So in here, for example, we show that every time we increase biodiversity, that is this plus in the first column in the left, it shows when a nexus element is plus, is increasing or is improving, and less is decreasing or is being negatively impacted. For climate change, the opposite. So plus is I'm improving climate, so I'm decreasing climate change, and negative is I'm intensifying climate change. Climate change is getting worse. And what you can see that is very interesting here is that every time I improve biodiversity, our health is strongly positively impacted. Every time I lose biodiversity, our health is negatively, strongly impacted. Climate change, every time I'm intensifying climate change, I'm also strongly negatively impacting our health. And when I try to mitigate climate change, it has the opposite effect. What is also interesting to see is that we don't really have a lot of studies showing how health is affected using this nexus approach. So we do have a lot of studies with bilateral interactions showing biodiversity and health, water and health, food and health. But what we wanted to show here was those intercascading effects. So every time we change one element, this is also going to produce, for example, I'm improving biodiversity, I'm going to improve water quality and quantity. And this can also improve foods quantity and quality, that can also improve human health. So we were trying to get those cascading effects. But it's also really interesting to see that one, human health is the most neglected nexus elements. And at least using this lens, the nexus lens, the health was never studied as the starting point of a cascading effect. So every time we are looking at health, we're always looking at this outcome. We are always being affected by all those direct, indirect, direct drivers, and all the other nexus elements. And this can be like very variable depending on the human health element that you can build, but in general, this is the general effect. And the assessment also shows that if you keep doing what we're doing, if you don't change what we're doing, we are going to have a negative impact in all those 5 elements. So as you can see in the last line of this table, that is the nature over exploitation. This is our current trends. This is in our future, what is going to happen if we just keep doing what we have been doing for the past 50 years. And we can see that we have a strongly and moderately or slightly negative impact on all the 5 nexus elements, including health. What is interesting about those future scenarios is that when we just think about one of the nexus elements, I can also have trade-offs and also have negative effects for the other health elements. So for example, here, for what we call the conservation force, that is a scenario that just thinks about biodiversity. So I'm just considering my policies to deal with the loss of biodiversity, not integrate any of the other elements of the nexus. I can also have negative effects for food and variable for health. So that means that I assume that all upstream prevention that I do is the same that I do for normally for the loss of biodiversity. I'm also going to have variable impacts on human health. And what this graph shows that we don't have highlighted here, but we can see looking at those green arrows, is that if we use a more nexus-oriented approach, if we consider all those 5 elements, I can have positive effects for all the 5 elements. This is what those 2 first lines are saying here. So this shows that we really need to start integrating more than one element if we really want to make sure that we're dealing with this polycrisis in an effective way. And how to do that? So the assessment suggests that one way to do that is integrate what we're calling the response options. And my slides is not moving, just 1 second. My computer is thinking, but I hope it moves soon. But while it's still thinking, those response options, they are, oh, now, sorry. Oh my God, now it's saying that it needs to restart no, I'll restart. Let me just restart. Let's stop sharing and then maybe.
No problem. If you would want to re-show it or reshare.
Let me
Otherwise,
open the PDF. I have a PDF version.
it's all that knowledge in the slides. Very heavy.
Oh yes, but if one of you wants to share and then just go to the response, so that would be fine. Yeah.
Emily, I think you have it on hand, right?
Yes.
So I think she needs to share.
Yes.
Thank you.
You pull that up.
And I just said this is the first time that this ever happened.
No problem at all. I think
Let's start it at the beginning. Success yet?
Yes.
Or
yeah.
Yeah.
So if it if
okay,
you could go to the response option one.
Yes. Here, right? I think.
Yes, I also have mine back. So if you want me to share again, but let's keep. So next one, please. So those response options. Oh, one more. Yeah. So those options sorry, the next one. Thank you. So those options that we call nexus response options, they are those actions or policies that can support this effective, sustainable, synergistic governance. So they are really thinking in a interlinked way. And for the health sector specifically, 15 options were assessed, and they were selected because, one, they have evidence to be implemented worldwide, so we're not inventing any new option. It already exists, and it was already successful in some region of the world. It is feasible to be implemented, so it exists, and has a potential for transformative change. Next one, please. So it can also be effective not only for health, but also for the other nexus elements. And as you can see here, this just shows a few of those response options that were selected, but they are coming from all over the world. And if you look at the symbols, for example, the health is the heart, you can see that we have some of those options coming from Europe, from South America, from Asia, from Australia. Those are just a few examples. So if you can take a look at the map, and if you need to maybe use one response option to another context, it's easier if you look at the map and then you see, okay, like I have a project that is going to develop something similar to what Thailand did. So I can take a look and then try to apply this to another context. But this shows that all those options, they were really selected because they work. Oh, yeah, you can go to the next one. So in total, we had more than 70 response options. That is what we try to show in this wheel, that are organized by the entry point of the nexus element. So we have biodiversity in light green, water in this kind of gray, in another green, food, health, and climate change. But what is important to say is that they are all interlinked. So I'll try to show a few examples of the health response options, but I also try to show how, like, any of those options can be an option for health, because they were selected because they all have this capacity to really be positive for all the other nexus elements. Next one, please. And what is very important to mention is that all those 70 response options, too, most of them, they can also support the global policy frameworks. So they can also help in achieving the SDGs, the Global Biodiversity Framework targets, and the Paris Agreement goals. So they are also looking at those policy frameworks. Next one. And for the health specifically, the way those response options, they were organized or selected, it was thinking about the environmental health determinants and the individual health determinants. So if we look at the health challenges in this graph, I'm going to focus more on the response options that are related to addressing the environmental risks to health, because they're the ones that are most linked to upstream prevention. But you're going to see that all those response options, they are also interlinked in a certain way. So if you work on a response option that is mostly to promote nature benefits to health, it can also have a cascading effect on the ones addressing the environmental risks to health. So it's not that they work in isolation, they all have a cascading effect. And I'll also mention a little bit about this Nexus integrated healthcare. But for example, one of these Nexus integrated healthcare response option is implementing One Health. I'm not talking about that, but it's really for governments to start implementing One Health in their activities, and One Health education for people to start understanding those links. So I'll try to mention 4 or 5 of those that are more related to upstream prevention, but I'm happy to ask any questions later. But we have more than 70 response options. So my suggestion is really to take a look at the chapter 5s and see which response options can really be integrated in your context, and how you can, depending on the health aspects, which one you can use that is going to be also positive for human health. Next one. So talking about those options that are addressing the environmental aspects of human health, the environmental drivers of human health. The first one, I think, is very not basic, but it's very clear that if pollution is one of the main drivers of human health loss, any activity that is going to lead to pollution prevention is going to be positive for human health. So, for example, the promotion of clean energy, integrating green infrastructure or nature-based solutions, for example, they all can have a cascading positive effect in preventing pollution, even if I'm not directly working with pollution per se. So increasing the amount of green areas in urban settings, for example, can also have this very positive effect. But looking directly and specifically at the human health sector, we also have some of those response options that are directly linked to the health sector, but are going to have a cascading effect on preventing pollution. So, for example, the sustainable use of medicinal plants, reducing pollution with the health and care sectors. And another one that I'm going to talk more specifically in the next slide, please. So, for example, we have those three response options that are linked to our individual health benefits. They are not in the environmental health box if we organize in that way, but if implemented, they're all going to have a cascading positive effect in preventing pollution. So, for example, the net zero sustainable healthcare, it states that if we change the way we do the healthcare currently, that is mostly focused on reaction and not prevention, and we shift that to prevention, we are going to reduce the number of people that need hospital care, and consequently, we're going to also reduce the carbon and environmental footprints of the healthcare system, which doesn't seem huge, but 5% of all those CO2 emissions are coming from the healthcare system. And this is going to consequently reduce pollution and indirectly impact our human health. The next one, the two, I can put them together, is the sustainable use of medicinal plants and the nature prescription. So it states that if we increase the use of those natural medicines and we also start prescribing nature to people, we are also going to have a positive effect, increasing conservation and restoration, and consequently, we're also going to reduce pollution and positively impact our health through that pathway. Next one. Then we have two that are very specific for those ecosystems types. One is the mangrove conservation and restoration for health. And this talks specifically about mangrove because of this very important effect or ecosystem services that it provides in disaster risk reduction, especially with floodings, storms, and tsunamis. And considering that more than 1 billion people live within 15 kilometers of those mangrove forests. So if we conserve and restore those mangroves, we're not only going to decrease the risk of those floodings, storms, and tsunamis to have a very catastrophic impact on our health, we're also going to conserve and protect water. We can also provide food and medicinal plants. We can also increase human health through other pathways. And of course, we're going to also mitigate climate change. Then we have the forest conservation for health. And this one is very directly linked to forest ecosystems. But those are just a few examples. They can also be applied to any other ecosystem. If you can clearly link the pathway of how those ecosystems and the degradation of those ecosystems are affecting human health. So this option clearly links the protection of biodiversity in forest ecosystems with an increasing human health and well-being benefits. And I'm going just to show one example of how this needs to be very well planned, not to have negative impacts for some human health aspects. But a good example of that is the Healthy Parks, Healthy People that was established in Australia in 2000. And that was designed with health researchers to make sure that those parks were going to really deliver positive benefits for human health. Now it is a global movement, and is being implemented in other countries, in the US, for example. And in Costa Rica, I just saw a presentation from the government at the GFIP Forum one month ago in Nairobi, and they are also establishing urban parks, forest urban parks, directly linking to human health. They're also working with health researchers and practitioners to make sure that those parks are going to deliver health benefits. We have a very important paper that says that those forest urban settings, they need to be at least, we need is 300. We need to have at least, I think, 3 trees in a buffer of 300 meters from every people, and then they need to be maximum at 3 kilometers from everyone. So it's not only creating those settings, those spaces, but also how we are going to enable people to use those spaces. So it really needs to be well planned with the health sector. Next one, please. And then the last response options that is related to environmental determinants of health. Health is the biodiversity management linked specifically to zoonosis. And here is mostly any activity that is going to stop biodiversity loss, but also decrease the chances of contact rates between people and wildlife. So an integrated land use planning, for example, that is going to avoid encroachment from livestock into wild habitats, for example, regulating wildlife trades. Any activity that can decrease those risks can be considered one of those response options for biodiversity management for zoonosis. What is important to say, that we also mentioned the assessment, is that increased conservation per se, without considering the health sector, is not guaranteed that is going to prevent those zoonotic diseases. Especially for zoonotic diseases, is very context and disease specific. Each disease is going to have its hosts and vectors that are going to have different ecological requirements and different transmission modes. So we really need to understand those cycles and really try to make sure that the response option is going to solve or is going to be planned considering those aspects. So it's really disease specific. And I'm just going to bring one example here. In one study, we were trying to understand if protecting indigenous territories in Brazil, which is a tropical forest, it was going to have positive effects for zoonotic diseases. In here, decreasing the incidence of those diseases. And we were looking at 5 diseases: Chagas, hantavirus, cutaneous leishmaniasis, visceral leishmaniasis, and Brazilian spotted fever. And those purple, red dots shows that we can decrease the incidence of those diseases if we increase the amount of area protected by indigenous people in this region. However, for cutaneous leishmaniasis, we can also see a blue dot, which means that for this disease, we are going to increase the risk. So this shows that even if we try our best, we can have those trade-offs. So we need to be aware and plan it to make sure that at least if we are increasing cutaneous leishmaniasis, we can at least try to understand what are the exposures, pathways, and what is happening that people are going to be infected, like how people are getting infected, and try to work with different pathways of those risks. Next one, please. And just to show a little bit more, when we move to the Amazon, here, the idea is the same. Protecting indigenous territories can affect our health, and we're looking at 21 fire-related diseases, and also 5 or 6 zoonotic and vector-borne diseases. And we can also see that it is highly dependent on the context. All those blue and red dots, they show that for some diseases, it can have a positive impact, and for other diseases, it can have a negative impact. So we can see that this pattern of disease and context specific, it happens even when we move from one region to another. Next one, please. So in summary, for example, in this study, what we saw is that those indigenous territories, they just start to have a positive effect in decreasing those diseases if the context is not so degraded. So if they are inserted, they're going to be implemented, or they're going to be tenured in a context, in a region that is highly degraded, this means that I need more area being protected for those ecosystem regulation services, the disease regulation services start to happen. So this means that I really need to understand the context to make sure that I won't have negative effects. Other way, if I just protect a forest area in a municipality that is highly, highly, highly degraded, I can have negative outcomes. And that's okay. We just need to be prepared for that. Next one. One thing that is very important to say, as I was saying before, all those response options, they were assessed and they were chosen because they have this power to be transformative. So this means that they also have positive effects in all the other nexus elements. For those health options, all the 15 response options, I just talked about, I think, 5 or 6, they all have positive effects for all the other nexus elements. So if you look at just the health sector and we start applying them, I will have positive benefits for biodiversity, water, food, and climate change. Next one, please. And that's why when we look at all those 70 response options, you can also select other response options that were developed for biodiversity conservation specifically, for example, but they also have positive effects for human health. Importantly, not all of them will have positive effects for all the nexus, but they will have positive effects for the majority of those nexus elements. So for example, here, I am highlighting a few that can be very important for upstream prevention. That is forest landscape restoration, the restoration of inland water systems, sustainable inland fisheries, integrated landscape and seascape approaches, land and use planning, and urban nature-based solutions. They all have positive effects for human health and are easily upstream prevention options that can also have those cascading positive effects. Next one, please. And I'll just talk a little bit about 2 of the biodiversity, that is the forest landscape restoration and the integrated landscape approaches. So the forest landscape restoration is a process that aims to regain the ecological functionality and consequently improve human health and well-being. So it means that we are moving away from planting trees to really try to restore the integrity of the ecosystem that it is already degraded. But at the same point as the conservation, just restoring areas alone can increase the zoonotic disease risk because it's highly disease and context specific. So I'll just give you 2 examples before I finish. That in one study with hantavirus that is all over the news now, in Brazil, we're trying to understand how environmental degradation could affect the abundance of those hosts that can transmit the virus. In Brazil, it is transmitted by these very 2 cute rodents. They are generalists. It means that when with the forest, they really adapt very well, they expand their abundance. So for example, in this study, we saw that when with the forest in a landscape, if I lose more than 30% of the native habitat, the abundance of those species increased by 300%. Next one, please. So based on that, we were really thinking like, what can happen if I just increase the amount of forest cover and restore those forest areas? And in Brazil, we have a legislation that says that everyone needs to keep at least a part of their property protected. In this region is 20%, but no one really respects. So what we did in here was let's create a scenario where we are going to increase the amount of forest area until our legislation is accomplished, like it is being respected, if I say that way. And then when we do that, we see that the abundance of those 2 rodents, they can decrease a lot in almost 50% of the Atlantic forest region. For one species, this reduction can be up to 50%, but the other one, almost 98%. But what is also interesting to see is that if you look at this figure on the right map that has a little bit of blue, the blue shows that we are increasing the abundance of this species. Even if I have a huge reduction in the abundance of this species, 98%, in almost 50% of the Atlantic forest, in 1 or 2%, I will increase the abundance of this species. This happens normally because I am creating forest areas in places that didn't have forest before. So I am creating a suitable habitat for those rodents. And if I have forest area that in a range of 10,000 kilometers, they can recolonize these new patches, but they're so small that they just are enough for those generalist people to, generalist species to thrive. And then I end up increasing the abundance of these species. Next one, please. But what is interesting is that if I don't really have, like, if I already have forest areas and I just want to restore and increase the amount, doesn't matter the spatial arrangement of the new areas, just by increasing the amount of forest cover, I can reduce the abundance of those rodents in most of the region. When we look at the yellow fever, for example, is a different story. The mosquitoes, they really can disperse using those small corridors and those small fragments that we call stepping stones, and they can disperse the virus through the landscape if I have a highly fragmented or connected landscape. So this shows that if I have huge blocks of forest, with that is like a land sparing, land sharing approach. If I have a more land sparing approach where I have all my conservation lands in one site to be protected, I can decrease the risk of this disease. Next one, please. So this shows that even restoration approach, they need to be really well planned. I really need to think the context, next one, please, and how I'm going to do that. What is the spatial arrangement of those efforts? That's why the integrated landscape approach is super important. It's how I'm going to incorporate human health into landscape planning. And here is just to give one example of how the context is important. So if I am restoring forest areas in an already highly degraded, that I have a very, very, very low amount of forest cover, I need to restore a lot of land to be able to have negative effects for human health. Otherwise, I can increase. If I have an intermediate amount of forest cover, then the spatial arrangement is going to be really important. So this, of course, is going to be disease specific, and this is not a reason not to restore. It's the opposite. It's just let's restore, let's start doing. We just need to be aware that I can have negative consequences, and then I can work to really avoid exposure or other risks. But it's really just to show the importance of planning, because all those upstream prevention activities, all those response options that are only related to conservation, they can have negative human health impacts if not really well planned with the human health sector. Next one, and this was the last one. And I'm just like, here's the QR code, I think just can, and I really, I think like just read all the 5 chapters. I think they're really useful. They can really be an open mind on how really to integrate some response options that you never thought before to human health. Next one, please. And I just want to acknowledge that in this picture, I just have the coordinating lead authors. We're just in 25, but this assessment was produced by more than 165 people. So I really want to say thank you to all of them. And thank you.
Thank you so much. We are running a bit late now because I mean, your presentation was really, really interesting, and I didn't want to interrupt you because I think there was so much to go over and it was really, really rich content. So thank you so much for that. I think we have maybe, I just see about 6 minutes we have to just do a little quick Q&A if anyone has any pressing questions. There's just a lot to unpack. I'm just trying to see if anyone has put questions under Q&A or on the chat. I see a lot of applauses from people, the emoji, so that's great. I think, yeah, I mean, it has been really quite eye-opening personally for me. Maybe I can just start off with an observation. I think what you highlighted is really, really important, Paula, about sort of the nuance of the situation. I think that's what you were trying to get at, is really, we cannot really make blanket statements because it is such a complex picture, and it needs that nuance, it needs that understanding. And I think for us at Nature for Health, that's precisely why we really try to promote a systemic approach. I think this assessment is really, it kind of validates that approach, because you do need to go down to the context-specific issue or region or country level or whatever, work across, I guess, bringing in different stakeholders and people and views and lenses and issues, all at the same table to be able to determine sort of, the way forward. And that's really what we try to promote with Nature for Health. I think that it's very clear that you cannot focus on a single topic or a single area, right? Because it can have knock-on effects, a negative impact, especially. I think what you highlighted about the zoonosis aspect is really interesting, that, neither restoration or conservation don't always exactly lead to a positive outcome when it comes to something like zoonotic diseases. You have to look at the disease, the way it travels, and all of that. So that was a really interesting observation for us, I think, in Nature for Health, as we are trying to focus so much on this idea of upstream prevention. Yeah, I think it's, and I see some comments are coming in. I think for me, I'm sorry, I'm just going to keep talking. I think for me, what's really interesting is the science, or sort of the information, is getting clearer. The correlation around things is getting clearer. But I think we're perhaps, and that's maybe the next frontier, or maybe the next idea for an assessment, is how we can take this to the policy level, right? Like, we talk about One Health, but we really have challenges of integration, and creating those enabling conditions for, it's not even collaboration. I think it's integration. It's going beyond that. So maybe that's something to think about. But I don't know if you have any thoughts on that. If you want to come in on that topic.
Oh, I can give my personal thoughts. I don't know if they are going to be useful, but I think this is the challenge, right? But I think if we start acknowledging that those bridges, they need to be crossed, and then we start bringing everyone together. For example, there is a very good example. I'm sorry, it's all from Brazil because I'm from Brazil, but there is a very good example in Brazil where it's, in one state, in São Paulo state, the environmental and the health sector, they put a regulation together, because we have a huge number of cases of Brazilian spotted fever in São Paulo, because it's highly degraded, it's very populated. And so, and in every environmental impact assessment, depending on the region, if you have those spotted fever cases happening, even in the past, the environmental impact assessment needs to do a health assessment. It needs to really evaluate the tick abundance, if they are infected with the bacteria, and what are the risks for people. And then they do a joint evaluation of the environmental impact assessment. So if there are any risks for people because of the Brazilian spotted fever and because of the change that they are proposing to do in the environment, they evaluate together, and then they just block the construction to occur, and then just suggest how they can do in a more healthy way, if I can say like that. So I think this is a very good example that sometimes a very small thing can really change a lot. And we saw reduction of Brazilian spotted fever after that, because we had like numbers increasing, because we had the environmental sector just approving, because they didn't know that depending on what they were doing, it could increase the risk. So I think, like, if we start like crossing those bridges and working together for the same ideal, it can really work. But you need people that really want it, is willing to do that.
Yeah, no, absolutely. I think that, there has to be at every level that understanding that this needs to happen, that integration needs to happen. I see Abdi Rahim's hand is up. Apologies, I know we're going over a bit, but if people can stay back for a few minutes, we'll try to just address, or if you have to go, that's okay as well. Yes, over to you. Abdirahim, I don't know if you can hear us. We don't hear you, in case you're talking. I think, okay, I've allowed the mic. I hope that helps. And I think if you can unmute. If you're able to unmute.
I'm seeing two questions in the chat. Do you want me to answer? One from Carol and one from Natalie?
Sure. yeah, okay. Sorry, I missed those questions. Maybe we can go to those quick questions. Apologies, Abdirahim. Maybe you can type in the message if you don't mind. I think we're having some glitch with unmuting here. But yeah, go ahead, Paula.
So Carola is asking, what are your advice on methodologies to be used to support countries or territories to reach agreement on nexus balanced responses? My suggestion would be, I think if you look at those response options, most of them, they already been integrated into the conference and subs and cities, like they're already there. So I think a methodology to be more, I'm not an expert in those systemic approaches, but it would be really try to bring everyone together to better integrate what you're already doing with the different sectors. And then I think the second is very similar from Natalie, is whether you see countries being able to take up this approach at this time, given the, so they, as we said, like they're already doing. I think this is the beauty of those 70 response options of the Nexus. Most of them they're already doing. So it's not hard to really adapt a little bit or really just to start thinking a different way.
Yes. Yes, absolutely. And I think one of the things that I found interesting about what you said is, I think you had highlighted that, you know, sort of, for example, parks and green areas and forests can have a positive correlation on health. I think these are very interesting points that I think down somewhere we know this, but we have never seen it sort of validated. And there's a lot of traditional knowledge behind this, indigenous knowledge behind this, cultural knowledge, which acknowledges this. But I think this assessment provides that sort of platform to have that knowledge be more widespreadly understood. And yeah, I think it's a really relevant point. So found that quite interesting. I still, yeah, I'm sorry, Abdirahman, I'm not able to get you. I did allow the mic. I think we have some issues with the webinar platform. It's not super convenient, but if you're able to type your message, otherwise, please do send us the message or yeah, email. Great, thank you, Paula, for that. I don't see any other points or questions, but I would then just thank you. I think we're okay on time then. I would just really thank you for a fantastic presentation. This was really helpful. I know quite a few people asked about where we could get this presentation. If you don't mind sharing it with us, we can then circulate it to everyone. And then we will also have the recording up quite likely on maybe the website for Nature for Health, but we, for those who would like to follow the webinar recording at a later stage. But and just to quickly announce that we are planning on having our next webinar in early June, so do look out for that. And we will have our colleagues from WCS. I think some of you guys are already online in this webinar, so you will be presenting to us on your experiences with work in the upstream prevention space. So really excited to have that as well. But with that, I'll just thank everyone for joining in and wish you all a great day. And see you all soon. Thank you. Thank you. Thank you, Paula.
Bye-bye.
Thanks.